Welcome to the third video of the series related to problem-based learning. And in this video, we will learn about how experienced facilitator can facilitate a problem-based learning. My name is Muhammad Hassan Taha. I am the director of the Medical Education Center and the coordinator of the Master of Leadership in Health Professional Education and PhD in Health Professional Education. In today's video, we will learn about how experienced facilitators create a transformative learning experience for the learners in problem-based learning. And let us start with this important slide here. In problem-based learning, there is a paradigm shift from the traditional approach of teacher as a master, to facilitator as a guide in PBL. In classical approach and traditional approach, teacher consider as expert, explain the lecture, correct the mistake directly, dictate learning issues, and students are passive. While in problem-based learning, the members of the group, they lead the learning process. They ask, they listen, they redirect with the questions, and they own their own learning, and they are considered as active constructor of the learning process. So we have to balance between being a teacher who dominate the discussion, and on the other extremity is the one who is totally detached from the learning process. And we have to keep balance in between. So this is called a Goldilocks zone of the facilitators. Neither too hot, dominating, nor too cold, detached, as you can see here. Let's see. So who is a dominating tutor? A dominating tutor is the one who is answer the question directly for the students. The one who is not patient, correct every mistake immediately. The one who dictates learning issues. And the one who talks more than the students. And the one who is control the group discussion. We should avoid being in this extremity. Now let us see who is a detached tutor. The detached tutor is the one who remains silent throughout the PBL session. Is the one who allows misconception to persist. Is the one who ignores the group process issues. Is the one who is disengaged from the group. Is the one who is provide no direction at all. Also, we have to avoid this behavior from the tutor. Then, who is the effective facilitator? Effective facilitator is the one who asks probing questions. Is the one who monitors the group dynamics, is the one who redirects without revealing, is the one who balances challenge and support, is the one who gives timely and specific feedback. So this is very important thing that we have to consider while to position yourself in problem-based learning. So in a summary, we have to position ourselves as effective facilitator in problem-based learning. Now let us look at your role as facilitator in the different sessions, in session 1 and session 2 in problem-based learning. And in session 1, in which students will learn the first 5 steps. During the brainstorming session, which is basically session 1, our role as a tutor is to probe prior knowledge, activate existing schema. In identifying gaps, not to correct them immediately, then we may ask them questions so that can support the students to identify their gaps. We may encourage hypotheses by ask what if questions rather than give them answer. We may monitor reasoning by elicit the thinking process by supporting them to develop their clinical reasoning. It's very important to redirect gently the discussions if the discussion not within the scope of practice. And please bear in mind the first session, which is related to brainstorming session, goal is surface prior knowledge and identify learning needs, not fill the gaps immediately. It is in the wrap-up phase, ensure the knowledge integration and transfer connect the learning process. And one of the common mistakes, the tutor who fill the gaps during brainstorming session, this will affect the students' critical thinkings and it will not help them to come with the right learning needs according to the problem-based learning. As a tutor, your role in wrap-up session, which is the second session, last jump, is to promote integrations in which students they can connect new with the prior knowledge, encourage transfer of the informations by how does this apply to practice, maybe ask this question, consolidate understanding, maybe ask them to summarize, evaluate reasoning quality, not just factual recall, and provide constructive feedback at the end of the session. Now let us learn about the group dynamics. It's very important to understand the group dynamics as a facilitator in problem-based learning. And let us understand how group evolve in problem-based learning. And this is very important thing that we have to consider. We have this, according to Tuckman, we have these 5 stakes in problem-based learning: forming, storming, norming, performing, and the fifth one is adjourning. So the group start polite. Then in storming, they develop conflicts. Then in norming, they share that, well, if they continue with these conflicts, then they will not achieve. And in performing, they start to become productive and so on. So your role as a tutor in forming, you have to organize, to build trust, to support, and to motivate. In storming, to mediate conflicts, to refocus them, support the leader. In norming, you have to step back, guide, stimulate, and reinforce norm. And in performing, observe, give feedback, and challenge thinking. Now, we'll provide you with some facilitation toolkit in which you can use this toolkit in questioning or raising awareness or knowledge. Will support the learner to provide to help them for the knowledge transfer on and to provide feedback effectively. Yeah, it's very important to consider these 4 facilitation roles and function in problem-based learning. Raising awareness, directing learning, probing knowledge gaps, and promoting knowledge transfers. For raising awareness, clarifying the medical terminology, this should be by the learners. Ask, what do you mean by that? This is a very important thing that you can ask to raise awareness. You have to elicit the reasoning process and ask, what do you mean by that? What if, and asking such question. You have to ask the learner to emphasize the mechanism. And you have to ask the students to summarize. This is a very important thing. Coming to the directing learning, you have to encourage connection between the concepts and refocus drifting the discussion, redirect toward the correct path, and provide structure feedback on the process. And always try to ask them to link theory to practice. Regarding promoting or probing the knowledge gaps, you have to use this during the brainstorming sessions and never ever reveal answer. Ask such question: what would happen if? What is the evidence of that? Is that always the case? Regarding promoting knowledge transfers, we use this during wrap-up sessions. How does this apply to your patient? What other conditions share this mechanism? And you have to encourage analogical reasonings and connect to real clinical exposure. And this is a list of questions that you may use for clarification or for assumption or for evidence or for reasoning or for implications or for perspective. Please take a screenshot from these slides so that you may use this later. For clarification, you may ask, what do you mean by this? Could you put that another way? Can you give me an example? For assumptions, you may ask, what are you assuming here? Is that always the case? How do you justify taking that for granted? And for evidence, you may ask this question. What is the best evidence for that? How do you know? Is there reason to doubt this evidence? And for reasonings, you may ask, how did you reach that conclusion? What led you to that belief? How does this relate to our problems? And for implications, you may ask, what effect would you have? What are you implying? What else might happen as a result? And for perspectives, you may ask, can someone offer an alternative view? What would change your mind? Could we find out if this is true? So this, you can use this as a toolkit for questions. Now, you may stop the video and reflect. Think of the last PBL session you facilitated. Which question type did you use most? And which did you avoid? Please stop the video and ask this question. Now we'll go to the final stage of the video, which is about effective practice and evidence-based practice for accomplish problem-based learning as a facilitator. You have to join the group as a member. You have to remember the first slides in which is dominating or detached facilitator. You have to be effective facilitator and join the member. Don't dominate, and at the same time, don't be detached. Create authentic environment. Link problem to students' professional future, and this will motivate the students. Manage time, transitions, and group dynamics without controlling the content. Here, for effective questioning, use probing questioning to elicit reasonings. Never, ever give always answer. As knowledge connectors promote transfer of the knowledge by linking new knowledge to clinical context and prior knowledge. Give a specific time and constructive feedback. Accept critique of their own facilitators. The constructive feedback should be sharp, and sharp here for specific, helpful, accurate, respectful, and participatory. Always for specific relate feedback to observable, concrete behavior, not personalities. For each helpful, frame feedback so that the learner can act on it, not just evaluate them. Accurate based on direct observation, not hearsay or assumption. Respectful, delivered in psychologically safe environment. Private when corrective. And participatory, invite self-assessment first. How do you think that went, and so on. Finally, we'll go to the implementations. And here, the implementation section in this video, your personal action plan for the next PBL session. So please use this, and you may take a screenshot from this video before the session, during the session, and after the session. Before coming to the PBL session, review the clinical scenario and expected learning outcomes. Prepare 3 to 5 probing questions for each concept. Anticipate common misconception and plan redirecting question. Ensure the physical environment support the group dialogue, including the student setting and so on. And this should be clearly by those working in the curriculum development and case construction in the tutor guide for the case scenario. During the session, please remember the detached and the dominated facilitator, and don't be either detached nor facilitator, nor dominating facilitator, be effective facilitator. So, during the session, join the group as participants, not authority figure. Use Socratic question rather than direct question. Monitor group dynamic and intervene gently if needed. Give a specific timely process feedback mid-session. Ensure every student participates meaningfully. After the session, facilitate structured group reflection before ending. Gather student feedback on facilitation quality. Document one thing you did well and one area for improvement, and final share reflection with a trust colleague or a mentor. The take-home message from this series of videos related to facilitations: PBL facilitation is a learnable skills. Your role is to guide, not expert. Withhold all answers. Ask questions that surface reasoning. Group dynamics evolve. Adapt your facilitation skills accordingly across the document 5 stage. Forming, storming, norming, performing, adjourning. Probing questions are your most powerful tool. Build your personal repertoire from 6 Socratic categories. Feedback is transformative when specific, timely, and delivered in a safe environment. Reflect on your practice. The best facilitators are self-directed learners about their own teaching. Now we come to the end of this video, which related to facilitation of problem-based learning and how effective facilitators can facilitate problem-based learning. The last video of this series related to problem-based learning now will be related to the case scenario itself. Because in problem-based learning, we have 3 pillars: the case scenario, the role of the tutors, and the students. If any one of these pillars not perform perfectly, then they will be a serious issue in the system. So we have to take care about how to construct the case scenario in a proper way, and we will learn about how to write the case scenario in a proper way in the next video in problem-based learning.